Casa Grande is fairly unique in that we have a broad range of not only ethnicities, but the diversity of cultures. We have 45,000 people year-round, and then in the wintertime, our population increases by 15 to 20,000. Illegal drug use is very rampant in the Southwest, and Casa Grande sits in one of the largest and most active illegal drug corridors. Because of that, our community members are very aware of illegal drug use. One of our challenges in the prevention world is to have people understand that the abuse of over-the-counter medications, prescription medications, and especially cough medicine is also something they need to be concerned about.
Based upon our experience, there has been an increase in recent years in the abuse of over-the-counter cough medicine by students. From our experience with those students who have been found, we do know that parents tend to believe that we overreact when we respond to that. I really believe that there is a misperception among parents that because these medications are over-the-counter and that they are, for some reason, that they're safer for children, that they don't pose a risk to children.
The Casa Grande Alliance has done quite a bit to help our community in terms of over-the-counter and drug prevention. We've done a number of different activities surrounding youth activities, but we've also done a lot of education around adults.
We know that children are likely to abuse these substances, but adults really maintain and control the environment in which these children interact with the medicines, so we feel it's very important to educate adults. We did some outreach to a local employer that has an annual health fair. They have over 200 employees, so by participating in that health fair and doing education at that health fair, we're able to reach parents and other adults. We also do community-based health fairs where we do tabling and provide literature and information. We've done training with foster parents, and that gave us the opportunity to reach a group of adults that we may not reach in the workplace.
The Casa Grande Alliance provided a training to our Youth Justice Center here in Pinal County that is our youth detention facility. Our officers received training. They really liked the information because it was something that they could take home and use as well.
When it comes to reaching youth, we reached out to the local community college and we did a training to the resident assistants.
We're at a party and there was like this little bottle going around. I'm like, what is that? They're like, oh yes, cough syrup. Drink beer, they would drink another shot of cough syrup, drink beer. And I just never understood that.
One of the ways that we discovered that cough medicine abuse was dangerous and becoming more of a trend in our nation is when our staff members attended the CADCA conference and got the dose of prevention document. Of course, they attended the workshop, learned a lot, and came back with a lot of great ideas. We worked with our local newspaper and display advertising department to create a newspaper insert. We used the Stay Smart, Don't Start supplement that was put together for the Washington Times in collaboration with CADCA as our source document. This went to 17,000 families in our region, as well as extra copies that we'll be using for tabling and other events. We wanted to find a creative and interactive way to educate parents and other adults about the dangers in their home. So we created displays that actually represent 5 rooms of the home. In order to lead the adults through this display, we've created a scavenger hunt, which in the business we would call a pre- and post-test. But they have an opportunity to look at each box and then find the items that they may see, let's say in a child's bedroom, that would be abused.
We're from 18 communities, so my staff want the same presentation brought to their local parent committee so that their local parents can also see these are things in your home.
I didn't realize that some of these items I have in my own bedroom.
There's 3 things that I would say to coalitions who are challenged with prevention messaging. The first would be creative in where you find parents and other adults. Second tip that I would give is don't be afraid to do something that looks a little cheap and cheesy, because it really works with our displays. And the third thing that I would say is that we need to integrate the over-the-counter cough medication abuse message right alongside our illegal drug abuse message. So it's very important that we explain that cough medications, especially those with dextromethorphan, be monitored, secured, and if they're out of date, destroyed so that their children are kept safe.